Hello everyone, welcome back to Ask an Advocate. And today we're going to cover a short webinar on the medical benefits that may be available to recipients of income assistance, persons with persistent multiple barriers, or persons with disabilities. We are Ask an Advocate, which is a website-based project created to help clients and service providers find information and resources about income and disability assistance, tenancy, and other income supports. In this webinar, we're going to take a brief look at the medical benefits associated with income and disability assistance, specifically with the province of British Columbia. So please keep that in mind that all of the information provided in this webinar will be applicable in BC only. For more information on the benefits discussed in this video, feel free to take a look at the links we provided in the description box below. In this webinar, we will go over several of the medical benefit programs available to those receiving ministry assistance. We will cover topics of general coverage, additional supplements, and who is covered by these programs. As we enter our first section, we will touch on the programs providing health benefits to those on ministry assistance. And of course, we will go further into detail later in this webinar. When receiving ministry assistance, the recipient is typically automatically enrolled in the Medical Services Plan and PharmaCare Plan C. These two programs cover the vast majority of the eligible health benefits for those on assistance. However, not all medical needs can be met with basic coverage. To help alleviate some need for extended medical coverage, some recipients may qualify for additional health supplements for coverage over and above what is included in MSP and PharmaCare Plan C. Something else to keep in mind, however, is that any emergency dental services for the relief of pain are provided to all recipients of income assistance, disability assistance, and hardship assistance. Moving forward, we will discuss our first program, and we will take a look at the Medical Services Plan, often referred to as MSP. In terms of what MSP is providing, well, that may include medically required services of a physician or specialist, such as a surgeon, anesthetist, or psychiatrist. It could include maternity care provided by a midwife, physician, or specialist, diagnostic services such as x-rays, provided that it's through an approved facility and has been ordered by the appropriate medical authority. And lastly, dental and oral surgery when medically required to be performed in a hospital, as well as surgical podiatry. For qualifying individuals based on annual net income, MSP may contribute up to $23 per visit for the services you see on your screen now, such as acupuncture, chiropractic services, massage therapy, naturopathy, physiotherapy, and non-surgical podiatry. For our next section, we will discuss the other program providing medical coverage, which is PharmaCare Plan C. PharmaCare Plan C will assist in providing more general day-to-day assistance to individuals, such as coverage for most drugs prescribed by a physician, dentist, midwife, nurse practitioner, optometrist, or podiatrist who are licensed and practicing in British Columbia. However, in addition, it may cover diabetes supplies, ostomy supplies, permanent prosthesis, children's orthos, nicotine replacement therapy, and smoking cessation prescription drugs through the BC Smoking Cessation Program, as well as medications for medical assistance in dying. There may be certain drugs that require pre-approval for coverage, so depending on the medications you may be taking, feel free to check out the link in the description that will offer more information. And in this next section, we'll touch on general health supplements that may be available to recipients of income and disability assistance. While MSP and PharmaCare Plan C do cover a wide array of benefits, nothing is an all-in-one solution, and not every benefit will fit every need. In order to help bridge some of that gap, some clients may be eligible for additional health supplements. Some of the supplements may be assistance with basic dental coverage, for example. Something to keep in mind is that basic dental coverage requires the client to be eligible for general health supplements. They must be receiving disability assistance or qualify as a person with persistent multiple barriers. We'll include a link in the description to the ministry page going over the more nitty-gritty details such as the fee schedules as well as general amounts. In addition, there are supplements for alternative hearing assistance as well as hearing instruments. There are a number of different diet benefits that may be applicable to those on ministry assistance for those who require a special diet due to a confirmed medical condition, as well as extended medical therapy assistance that may allow for extensions to existing health supplements, and so much more. Don't worry, we'll include a link in the description box for this as well. And lastly, we'll go over who exactly may be covered by these medical benefits while receiving ministry assistance. The good news? The coverage provided is for the family and not just the individual receiving assistance. As you can see on the screen, a family can be considered just a single person, a married or common law couple, and lastly, a single person or couple who has a dependent child or children. As always, thank you for watching. If you found this video helpful, please consider giving it a thumbs up and sharing with anyone else who may find it useful. And of course, feel free to browse through our other webinars and provide us feedback by clicking on the survey link in the description below. Until next time, we'll talk to you then.